points of research I think are really interesting. The first one is a study from the New England Journal of Medicine. It's a section called Network Open, and it's a study looking at the Mediterranean diet and the adverse effects of pregnancy. Now, in pregnancy, lots of times women have many serious problems. They can develop hypertension, they can develop strokes, they can develop cardiovascular disease, they can develop diabetes of pregnancy. And actually, there's a certain amount of mortality that happens when women give birth. And so what we know now is that this is very important to have the Mediterranean diet. You got to get the battery. Helps to reduce the risk of this mortality of any adverse effect from pregnancy. And so the really important thing is to know that if you're thinking about being pregnant, or if you know any friends who are pregnant, you want to do a Mediterranean diet, which is exactly the same as the alkaline diet, high in fruits, vegetables, nuts, and seeds. So look at our alkaline diet, pay attention that you can avoid the adverse outcomes that may happen to a woman in pregnancy with a Mediterranean diet, which is the alkaline diet. And we like you to imagine when we use mine.
Okay, sorry.
Hi, everyone. So one of the interesting research points I want to talk about this week is a report from JAMA that mentions and looks at a study that analyzes women who are giving birth. You know, at birth, there can be lots of complications. These are called adverse pregnancy outcomes. The woman can develop hypertension, they can develop diabetes, they can develop cardiovascular disease. Excuse me, strokes can also concern, and a certain number of women die in childbirth. And they found that those women who are following a Mediterranean diet had much better outcomes, had much less adverse effects. Now, of course, we're fascinated by this because the Mediterranean diet is very similar to the alkaline diet. Lots of fruits, vegetables, nuts, and seeds, healthy oil in the form of fish, of olive oil, and a certain amount of fish. The Mediterranean diet is very much like the alkaline diet, and the Mediterranean diet has been associated with better outcomes in pregnancy and the woman staying healthier after she gives birth. I think that's a really fascinating thing. The second little piece of research I wanted to talk about was selenium. You know, I always talk about the mandala effect, that every nutrient affects every other nutrient. And we don't think of selenium much, but we should, because selenium is a really important antioxidant, very protective of the body. And we know that osteoporosis, for example, is largely due to oxidative damage. So this new research from the Frontiers in Nutrition, just in 2022, showed that women with the highest level of selenium had a very reduced risk of developing osteoporosis, as opposed to those women with a low level of selenium. You'll notice in the supplements I use, we often have 200 micrograms of selenium. That's a great amount. It serves as an antioxidant, helps the body produce other antioxidants, and it turns out it's very important for bone health. So we put selenium on that list of the 20 key bone nutrients we really want to pay attention to, and the 20 key nutrients and all of the nutrients to maintain and enhance immunity, especially as we move now into the cold season when we want to have a very strong immune system. We not only need zinc and quercetin and vitamin C, but we also need selenium. The final study is from MIT, and this is really interesting for those of you who actually have heard of ApoE4 or who are concerned with Alzheimer's. some of you might know that part of the recent science on Alzheimer's is suggesting that there's a certain genetic mutation, and this is called ApoE4, and about half of the people with Alzheimer have that risk factor, have that particular mutation, and about a quarter of the population as a whole has that mutation. And that mutation of ApoE4 puts you kind of like almost doubles your risk, or at least is a 30% more risk of developing Alzheimer. I know about it because I happen to get the 23andMe test. That's 23andMe. It's genetic testing that's done with a little bit of your cells from your cheek. And it was found that I carry that ApoE4 genetic variation. And so I am at a greater risk of developing the Alzheimer's disease. And so I was very taken back by this article that mentions the damage to ApoE4, they're starting to figure out, has to do with how it affects the phospholipids in the cell membrane. As I've told you before, the cell membrane is like the brain of the cell. It decides what's going to come into the cell, what goes out of the cell. And we've mentioned that the omega-3 fats form a lot of that cell membrane, and they're kind of the gatekeepers. So we love the omega-3 fats, which are also associated with a reduced risk for Alzheimer's. But what this new research at MIT shows is that damage to the phospholipids and to the cell membrane, which occurs because of ApoE4, is actually greatly alleviated by choline. Now, you remember I've been talking about choline, that choline is an essential nutrient, a B vitamin-like substance, which we fail to recognize that 90% of the population is deficient in. So now MIT is saying this ApoE4 and the damage of ApoE4 can be largely alleviated by taking choline. And of course, we use a liquid choline citrate in a very potent form, in a very pure form. And so if you have kind of a family history of Alzheimer's disease or dementia, it's very interesting to get the 23andMe test and to find out if you have this genetic variation, ApoE4. And if you do, it's all the more reason to take your fish oils and to certainly take choline. As an anthropologist, I was interested, how did this ApoE4 mutation develop? Because all these mutations happen over thousands of years, and they must be selected for in some sense, or else everyone with ApoE4 would have died. But what happened is ApoE4 helps to protect from parasitic and other infections. So during evolution, it was probably a great benefit to have this genetic variation of ApoE4 because it was protective against infections. Now, in modern life, we aren't running around barefoot. We aren't out in the jungles. We're not exposed to those infections that ApoE4 protected you from, parasites and that sort of thing. And so it's not so selected for. And they come to find out it tends to damage the phospholipids in the cell membrane, particularly if you're low in choline. So we're back to the same old story. We want to get adequate levels of all the key nutrients. They all play together and they all interact. It's especially fun when you look at the anthropological point of view of why did this mutation develop and what function did it serve, but it does maybe not serve that function now, or maybe it's just telling us we got to bring our choline up to the level that it used to be, which is a very simple thing to do with eating eggs, things like liver that we don't eat anymore, for example. Liver is a great source of choline, and of course, choline supplementation. Okie doke, well, we're going to have fun. This is 2023. I hope you stay tuned. I hope you let us know how you're doing. If you have particular questions, we're happy to answer them. We're going to dive deep into pH balance and what it means. And just as a little teaser on that, I want to tell you some new research from Germany that I just saw, that when an infant is born in Germany, it's a law, it's a requirement that the pH of the umbilical cord is measured. And that they see has a great influence on the health of that child and what danger that newborn is being exposed to immediately if they're going to need special care. So pay attention. We're going to have a lot of fun with pH. Get back to your New Year's resolutions about alkalizing and doing your exercise, and we'll talk soon.